and welcome to the 21st Medical Group. I'm Colonel Patrick Pohle, and I am accompanied by my superintendent, Chief Master Sgt. Dan Stellabotte. It is a pleasure to join you again for a virtual town hall. This is our April rendition, and I believe it's our third opportunity to bring this to you. So we do have a few questions to go over today, and we'd also like to just offer up some information that we hope will be helpful in the coming months. What we would like to do first is start with some of the questions that were sent to us by folks that have viewed our previous town halls or were able to get online and simply upload some questions for us. So with that, Chief, this first one I'd like to hand off to you. Okay?
Yes, sir.
Please address the safety of the vaccine at your next town hall and the need for all of us to get vaccinated ASAP. And this question goes a little bit further to acknowledge that coworkers in this individual's office have already stated that they're not going to get the vaccine. So Chief, if you could you speak to the safety and the recommendation to get the vaccine?
Yes, sir. And to the audience, thank you for the question. Appreciate your question. And so I'll give some context and some background as well. To date, we've had over 167 million shots or vaccines administered in the United States, and they've proven to be safe and effective. The data shows that the majority of these shots are over 95% effective on protecting the individual that receives a vaccination from the COVID disease and some severe symptoms that come along with that. Here at the 21st Medical Group, we recommend that if you have the opportunity to receive one of the 3 shots that are out there on the market, to get the shot either in our clinic or out in the local community. There are certain areas where you can sign up for the shot, and when they have it available locally, they will contact you and help you sign up for that shot. Additionally, we have kind of the same battle rhythm. When we're ready to move forward with vaccinating certain groups, we will touch base with a point of contact within that organization and set up for members that are wanting to and willing to receive their first vaccination. Now, some of the safety concerns that folks have, yes, there are side effects, but most of those have proven to be very minimal. Rest, recuperation, hydration, and sometimes maybe over-the-counter meds such as ibuprofen or Tylenol are necessary. But within 24 to 48 hours, those side effects have worn off, and the individual is right back in the fight. More so, you'll see those with the second dose with these shots, with the Pfizer and Moderna, which require a second dose. That's generally when you'll see some more of those side effects. Again, though, if you have the opportunity, the reason behind being protected from the COVID virus is to be vaccinated and hopefully achieve herd immunity at some point so we can get back to a more normal way of life.
All right, thanks, Chief. And while we're on the topic of vaccines, I also wanted to offer a little bit of a status regarding our vaccine situation within the Peterson-Schriever Garrison. We are really getting pretty excited because the flow of vaccines, the supply line, has improved significantly over the last several weeks. In fact, when we first started off way back in January, it seems like it's way back at this point in time, we had a lot of difficulty with the initial flow. In other words, we weren't receiving very many vaccines. With those vaccines, we had to prioritize who received them first based on the Department of Defense's schema that prioritized for us who should receive those initial vaccines. We started with groups that were considered part of our critical national capabilities. As we've gone forward then, we've been able to go beyond that to certain groups of mission essential personnel, for example, food workers, child care workers, and we've been able to move on down the line. At this point, we are still wrapping up those initial groups of folks, but we've also been able to open some appointments to individuals within our beneficiary population who may be at heightened risk for certain illnesses or disease. In those cases, we've been able to offer appointments through our central appointing line for folks who have one or more risk factors and get them into our point of distribution line for the vaccines at this point. What this means is, and the reason we're getting pretty excited, is we're probably within a week or two of being able to open up to more of the broader beneficiary population. When that happens, we'll make sure to do some basic marketing through our Facebook pages, through some of our pushes that we do through secure messaging for our patients, to let you know when you'll be able to call to our central appointing line to get an appointment for your vaccine.
So we're moving on to our second question from the audience. And Colonel Pohle, I'd like to pose this question to you.
Absolutely.
So this individual says, thank you for doing the town halls. I recommend making a video on how to properly wear a mask and also go over DoD guidelines on when to have or when to wear a mask. Does this include proper mask wear? Are vents allowed and so on and so forth, sir?
Thanks, Chief, and thank you for the question. Masks is an interesting topic. In fact, mask wear has taken on a life of its own. Some of the discussions around masks are political. Others are simply knowledge-based. How do I wear a mask? What type of mask should I have? So I'm happy to talk through a few of those aspects with you. First of all, we didn't have the capacity to create a separate video specific just to mask wear. But nonetheless, we can attach a link along with the link for this video that helps you get to the CDC website, which does a much better job of explaining appropriate masks, appropriate mask wear, when should you use it, how should you use them. But for now, let me cover just a few basic topics with you. What the CDC basically says is masks should be a cloth material, so that makes it relatively easy to breathe through. Hopefully more than one ply. They should be tight-fitting to your face, and they should cover both your nose and your mouth. What I have noticed a lot when I'm out in public is that a lot of masks are down just over the mouth and really sitting more on the chin, but they don't cover the nose. They need to cover both. And what is the purpose behind the mask? Well, a lot of people think it's so that you don't necessarily contract COVID. Well, I'm sure it's helpful for that, but really it is so that you can prevent your own spread of COVID to other people. And it's interesting the misinformation that goes on regarding masks. For example, I saw a snarky social media comment that talked a little bit about how masks don't really work because the virus is so small that it's like wind blowing through a chain link fence. Well, that's kind of interesting because the virus doesn't travel by itself. What are we really trying to stop then? Well, the virus would travel on vapor, right? When you exhale, there is vapor that comes out. It's along the same lines of why we tell people to cover their cough or their sneeze. You are trying to prevent the vapor, droplets, fluids from being expelled to other people. So what we find is masks actually do help with that spread. And by the way, interesting point, masks are not a new concept, especially for those of us who are medics. Within MTFs, for years, we have had what we call cough stations. If you go into an MTF, you might notice a station that has tissues, hand sanitizer, and masks. These have been in MTFs, as I mentioned, for years. And the reason is, if somebody comes in to see us and they have some sort of illness that has resulted in sneezing and coughing, a lot of our patients will choose to grab one of those masks and cover up, or they might be asked by one of our staff to actually wear a mask while they're sitting in our waiting room to be seen. So it's nothing really new for us for any sort of these, or any one of these illnesses that is likely to be spread through a sneeze or a cough. In the case of COVID, we're concerned about simply breathing within a certain distance of other folks, again, because that vapor can spread pretty actively around the room. So I hope that helps, and I hope that encourages people, if you don't wear masks when you're in those situations that are less than 6 feet, I hope this will encourage you to do so. We are finding that it does work.
Good information, sir. So I'd like to ask a question. If folks are receiving the vaccination, why are we still required to wear masks?
Great question, Chief, and I think this is going to become a more prominent question as more and more people get the vaccine, right? So here's what we know with regard to the vaccine. A few comments on this. First of all, we're not sure if the vaccine at this point prevents asymptomatic spread. So vaccines are still useful as we're going through this process. So that's one point. Another point would be that the vaccines, we just don't have enough people with the vaccine just yet. So while we still have a good portion of our population unvaccinated, then the mask wear continues to be helpful in that regard as well. Not to mention, when you're out on the street, knowing who has received the vaccine and who hasn't, well, there's just simply no way to know at this point in time. Another point I would make is that the vaccine has been shown to be good and highly effective, but not 100% effective. So until we get a little bit further down the road with regard to our response to this pandemic, mask wear is still an important part of our mitigation strategy as we're continuing to fight this battle. So in a nutshell then, let's continue to advise that people wear their masks. What kind of masks? Well, we would prefer more than one layer. Think a 2-layer mask, tight fitting to the face, over the nose and mouth, and please, no vents, nothing that really allows vapors to escape and expand into the room. So hopefully that helps, and thanks for the question. Okay, Chief, if you're ready, we'll move on to the third question, and this one's coming to you.
Yes, sir.
Are government civilians without TRICARE eligible to get the vaccine through the Peterson Schriever Garrison? What about mission essential civilians? If so, where could they sign up for a vaccine or to be notified? Chief?
Thanks, sir, for the question. And again, thank you to the audience member who submitted that. The answer to both of those, civilians and mission essential, is yes. And here's why. As we vaccinate different units and mission sets, you're a part of that mission set. So we need to make sure we're offering that to you as well. Currently, the process for that is our medical group team will reach out to either a first sergeant or a commander within that specific unit when it is your unit's time to receive the vaccination. They will then poll their team members and see who's available and willing to go get the vaccination. Now, hopefully by the end of the month, we'll have a different option to where an individual can actually self-book it themselves. It's a Defense Health Agency booking tool. More to come on that, but that'll streamline the process and it'll cut down on some of the inefficiencies that are created with trying to get in contact with different unit members and solicit that way. So you'll see that online. You'll be able to go on into that tool, book your own appointment, and then show up for your vaccination. So look for that to come soon. For now, we'll continue to contact your unit.
Okay, so that brings us to the end of the questions that we received. And again, thanks for submitting those. And if you would like us to cover any questions for you in particular, please send those to us through the links provided. And we'll address that come the May virtual town hall. We're happy to do that. But that's not the end of this town hall. We do have a few other topics that we'd like to bring to your attention and discuss for a few moments. The first one I wanted to talk about is the rollout of our new electronic health record. It's something we call MHS Genesis, and I might have spoken in this forum before about this, but we're getting close enough now that I think we need to offer up some information about how that's going to impact our clinical operations, and as a beneficiary, how it's going to impact your access to care. So MHS Genesis is a brand new system for us. It's DoD-wide. It's coming with a group of other bases as well, so that we're all standardized in terms of the information that we have access to, the information we collect, so that if you receive your care at the Peterson campus, for example, but then you need to go to Fort Carson to receive some sort of care, they will be able to access the same information. They'll be using the exact same tool because we're all rolling this electronic health record out at the same time. Based on the training that we've received, we think this new electronic health record will be great. In fact, one of the things that we are really excited about is the new patient portal. The patient portal will allow you from a device or from your home computer to be able to access information in one place that you would have had to go to several locations or assets or apps to access previously. We think it's going to be outstanding. The trying time will be getting from point A to point B. So how do we transition from the systems we have now to this new system? Well, the first thing you need to be aware of is the date for what we call our go live. Our go live is actually the 24th of April. That's on a Saturday. It's a soft go live for us to try out the system to make sure it's up and running. For patients, the first time people will really interact with that system will be Monday, then the 26th of April. But that's not where the changes start to occur. We will actually start to make certain changes that will impact you about 2 weeks prior to the 24th. So 2 weeks prior to the go live event. What's going to start to happen so that our team can learn the system, learn how to use it, be able to interact with it well, is we'll start to posture in the way that we'll posture immediately after the rollout. What that really means, and I'll speak specifically to primary care, what that means is instead of 20-minute appointments, primary care will stretch to 40-minute appointments. That sounds okay in terms of an individual appointment. What unfortunately that will do is it will take what is already a difficult time regarding access to care in terms of numbers of appointments available and when they're available, and will actually funnel that down and make it a little bit more difficult to get in to see us. So that's going to start about 2 weeks out from that time period. Then after the go live, we'll continue on at that or lower levels. The reason I wanted to bring that up in this town hall is so that everyone had a heads up that access to care is going to be more difficult. Now, because of other mission obligations we've had at the 21st Medical Group, we've also already had to curtail some services for certain beneficiary categories. For example, we know that for acute situations, acute requests from dependents and retirees, some of you might have already noticed we've had to defer those to our downtown network for care. We see this continuing and potentially getting a little worse, to be quite honest. In fact, we can see that going forward, we will have to refer some of our active duty members with acute concerns downtown, for example, to an urgent care center or to one of our sister MTFs for care based on the lack of access. The other thing that you might notice as well is that some appointments that might have been held to a 28-day standard will now be extended. So your next available appointment might not be for 6 weeks, when in the past we could have gotten you in within 4. We just want to set the right expectation and give you guys an idea of what's to come in the very near future. Now, the good news is, after we get through the go live, we will gradually start to increase our appointments again over time. So with each week, we will start to increase the number of appointments that are available because we'll be able to reduce the amount of time it will take to get through an individual appointment. So just wanted to make you aware of that we are going to face some lean times through the end of April and likely through the month of May.
Thanks, sir, for that perspective on MHS Genesis. I'm just going to add a little bit to that if you're okay with that. And really, I think folks have heard from General Brown and his Accelerate, Change, or Lose. What this does for us as a medical community, we're staying along that line with Accelerate, Change, or Lose. This is a new technology that we desperately need. And yes, up front, there will be some angst, but the return on investment for that future patient experience will be phenomenal. This system will be a cradle-to-grave system, if you will, where we'll follow you anywhere in the world. And so it'll be much more streamlined. Somebody, if you PCS from Peterson Air Force Base and you go to Offutt in Nebraska, they'll be able to pull up your record, and the same chart that was here at Peterson will be accessible in real time there at Offutt Air Force Base. And so we must continue to change in order to meet the needs of our patients, our beneficiaries. And so we appreciate your patience up front. We look for your feedback as well. But ultimately, the goal is to make sure that we're taking care of you, your needs, and your family needs. Sir, so you mentioned a little bit ago about curtailment of services. Would you be able to expound upon that for the audience and kind of explain what that entails, sir?
Absolutely, I would love to, Chief. So this is actually a very timely issue to bring up because over the last several months, we have had to cut back certain services. And specifically on the Peterson campus, we've had to cut back those services for certain beneficiary categories. For example, it's mainly impacted our dependents and our retirees. In fact, I've received some feedback and commentary that some of our retiree population in particular have felt marginalized, have felt that this was a way to push the retirees out of our MTF. What I want to do today then is reassure our population that we want to take care of everybody impaneled to us. In fact, the retiree population with dependents for this MTF is about 30%. So 30% of our patient care is for retirees and their dependents, which is fantastic. In fact, when we had to cut back on some of the services we were able to provide for our retiree community, my providers were frankly not happy with that. They want to take care of the patients that they are ultimately responsible for. Here are some simple truths, though, and facts that I have to put forward regarding our priorities and who we have to take care of here at our active duty MTF. Priority one for us is readiness of the active duty force. So if I start to lose capacity in terms of provider or other services throughout the MTF, I have to look at which categories I have to make sure I'm focused on first. So first and foremost, it has to be our active duty population. There are certain rules and certain policies that go along with that as well that actually don't allow us to send active duty members downtown without a specific referral. On the other hand, when it comes to my retirees and dependents, it is much easier through the TRICARE network to send retirees and dependents to off-base care than it is my active duty population. So the simple fact is, there is nothing intentionally done to marginalize or separate out anybody. It is simply a fact that I have to prioritize active duty care above other care within the MTF. At the end of the day, however, we want to make sure that everybody has access to care, period, whether that's within our MTF or whether that's part of our local network. So I hope that helps explain that a little bit. There's nothing political, there's nothing ulterior, no ulterior motives about that. It is simply based on priority for readiness of the active duty force. So one final topic that I'd like to address today involves our Exceptional Family Member Program Office, or what we know as EFMP. The reason this is a pertinent discussion today is we are right in the middle of the time when people are trying to get their PCS orders processed. The feedback that we've received is people are having a hard time getting in touch with that particular office, or they're having a hard time getting responses from that office. So I'd like to explain that just a little bit and where we're going as we move forward during this PCS season. So we have had some manning shortfalls within that office. We are in the midst of resolving those, but those have clearly backlogged us quite a bit. So what I want to offer today is a POC if you happen to be trying to work with the EFMP office, and some ideas about our way forward and what we're trying to do to address that backlog. So first of all, our special needs technician who's been working this program for us is a Staff Sergeant Kaylin Schnabel. The best way to get in touch with Staff Sergeant Schnabel is by email. We'll try to make sure we include a link so that you can get access to her. Since we do have a backlog, I've been in conversations with my Chief of the Medical Staff, and we've talked about how maybe we can increase the number of clearance appointments. So just please know we are working on increasing those appointments as we speak to try to make sure that we can get everybody seen in a timely manner to try to keep this process moving forward, because I know PCS season and getting orders can be a trying, anxiety-riddled time. So we're hoping we can take great strides in improving that process.
Thank you, sir. And I want to thank the audience first and foremost. I appreciate the questions that you're submitting to us, keeping us on our toes and making sure we're getting the information out that's necessary to make sure you're informed. I would ask that you follow the link that's provided, and you can continue to ask those questions because, again, this is a monthly town hall. We'll get the questions, we'll do our research, and we'll make sure that we're providing the information that you are asking for and you so well deserve. Again, our ultimate goal is to make sure that we're providing trusted care to the beneficiary network, and that's really what we're about here at this medical group. So thank you for your patience. Thank you for the questions. We look forward to the feedback that you're going to give us and ultimately the next set of questions. Stay healthy and stay safe. Thank you.